Big news today, and it's all over the internet. Trump retweeted a post referencing a CDC document that recently came out showing that only 6% of the coronavirus deaths had coronavirus as the only thing on the death certificates. That means 94% of the cases had at least one other comorbidity. And in fact, what's really interesting about this is that the average of the other 94%, on average, they had 2.6 comorbidities. So that's like 2 or 3 for every single person. That means if someone had 1, someone had like 4 to offset it. I mean, this means that we are talking about a very sick portion of the population that they're counting as coronavirus deaths. All right, so we're going to dig into it. First, I want to go ahead and address the naysayers, because I know a lot of people are, believing that this isn't significant, and really most people are just sticking their heads in the sand, and they're just not even commenting. I don't know if Facebook isn't showing people my posts today and yesterday, or I don't know what's going on. But it's like people are just silent about it. I guess the cognitive dissonance, it's hard for people to process this information. So they're just not talking about it. So I'm going to talk about it. And I want to thank you for watching. So obviously I cover this kind of content a lot. If you're new to this channel, my name is Jeremy with theawarenessrevolution.com. And I've done a documentary on COVID-19 in the early stages of it. I've made a lot of posts, and a lot of it has come true, is coming true. And I mean, that's what I've been posting on Facebook, taking old screenshots from a year ago, telling people, hey, this shit's about to hit the fan, because the censorship is just going through the roof. And I even post going back to 2 years when my original YouTube channel was deleted. I've not been able to build a big subscriber base since then. So, subscribe. I appreciate it. It helps keep me going. I haven't been doing videos very much lately because no one sees them. So, anyway, let me go ahead and tackle the naysayers. I realize a lot of people are just saying that COVID-19 was the straw that broke the camel's back for these people, and it's causing these older people to die. Just because they're sick doesn't mean that they don't get a chance to live and all these other things. But the thing is we don't know for sure that these deaths of people with 2 or 3 comorbidities were actually caused by COVID-19. In fact, even the 6% of the people, roughly 9,000 people at this point, even those deaths, we don't know if COVID-19 actually caused those deaths, because as I've done a video on before, there's no requirement to prove that COVID-19 is actually even in the person's system. They don't even require a test. And even if they do take a test, the tests are notoriously inaccurate. So we don't know for sure if COVID-19 has killed anyone. We don't. The causal relationship has never been established with COVID-19, so I know that sounds crazy, that's getting off the topic a bit, so I won't digress too much, but I just kind of wanted to throw that out there, at least for now, but if you have questions about that, leave me a comment below. I'll be glad to discuss it more, maybe in a future video. But, this is really significant because, we're thinking that COVID-19 is this really scary thing, this really dangerous disease, that's going to kill us, basically. And what we're finding is that it's not normal people that are being killed by it. And why this is so significant is because normal people are being affected by it. Not by the virus, but by the lockdown. They're unable to work or unwilling to work, because they just rather get unemployment, pretend like they're afraid of COVID. So it is really significant because we are all being forced to be in this together. We're all in this together is what they keep saying. But no, we're not. We're definitely not. Senior citizens with 2 or 3 comorbidities, they're the high risk portion of the population, you know. So why are people that are at an extremely low risk, people under the age of 25, people under the age of 35, why are they having to hide, wear masks? Why are they unallowed to live and continue in society like normal? When we already know that there's a small group of people that are the ones that are high at risk, and basically everyone else, I mean, it's really nothing if you think about it. You know, the flu season kills 50 to 80,000 people per year, so it's really not much more than the flu season. When you add pneumonia and all these other things that are the comorbidities involved, I mean, we don't know if, is more people dying right now from these same things than last year's? How does the pneumonia death count compare to the previous 5 years before it? The same thing with all these other comorbidities. And so we're going to need more information coming out, but it's looking like there never was a pandemic to begin with, which is what I said from the beginning. Think about this. If you were going to fake a large death count, how would you do it? Well, you kind of need bodies, which, at the beginning I thought was a possibility. Hey, maybe they'll kill a bunch of people. But, if you're going to fake it, you still kind of got to have bodies. So how do you get those bodies? How do you get dead people without killing them? Well, just go after the people that are already dying. So it's peculiar. If you look at the flu, there's, certain people that are high risk, and that's young children and the elderly. So what's weird about the coronavirus is it doesn't seem to affect young children like the flu does. Why not? What does that mean? Well, I can just tell you this. If you're faking deaths, it's going to be hard to fake a bunch of deaths of healthy 8-year-old kids, 5-year-old kids. Because 5-year-old kids don't normally die. They don't die that often. They do die, and they do get sick. But it's extremely rare. They usually live. You know what people 80 years old and up does? They die. They usually don't live very much longer. The median, the life expectancy, just like the average age, is around 80. It's last I checked, it was under 80. It was like 72 for men and 76 for women, something like that. So when a large chunk of these coronavirus deaths are people over the age of 80, these people are going to die of anything. They were just going to die. So how do we know these people that are dying are just not being, how do we know that they're not being mislabeled as a coronavirus death? Now, if we saw a similar type of issue with young children, just like we're seeing with the older people, then you could say, oh yeah, it's really deadly. Look how many kids it's killing. It's not just killing the old people, it's killing both. But the fact that it's just killing old people who are on the verge of death leads me to believe that they're not just, it's not the straw that's breaking the camel's back here. Because if it was a straw heavy enough to break the camel's back, it would also be, like the flu, it would also be killing other kids like the flu. So, so you could say, so a lot of people will say, the 160 or whatever thousand people that supposedly died with coronavirus, most of which had an average of 2.6 comorbidities, they say, okay, well, this still is a coronavirus death. Not all of them. Certainly not 100% of them. Because again, tests aren't accurate. And also, How do we know? How do we know it wasn't whatever the comorbidity was that killed them? We don't know. So we have to figure out, okay, so it's somewhere between 0% and 100%. And the truth is probably somewhere in between. It usually is. But when you factor, so you say, okay, well, so the coronavirus deaths may be over 9,000. Okay. But then when you factor in the fact that the tests aren't accurate, even some of those people who got the test, whether they had comorbidities or not, maybe they didn't have coronavirus after all. Like, for example, Governor Dwayne from Ohio was supposed to have a meeting with Trump, visit with Trump, and had to cancel because he said he had coronavirus. Then after the meeting was canceled, he got another test and found out he didn't have coronavirus. I don't believe that, but he probably just used it as an excuse to not have to meet up with Trump and talk about the issues. I don't know. But the point is it happens all the time, right? So that will lower the number. So yeah, maybe it's not 9,000, maybe it's more because some of these old people that died with comorbidities, maybe it's legit, and that inflates the number higher. But when you factor in the fact that there's not an accurate test, that will bring it down. So they kind of balance each other out. Maybe you lean more one way or the other, but it's still, we're looking around 9,000. Now, there was a guy who used to be an editor for I think the New York Times. I forget his name, but he looked into it, and he looked up the diseases that could have been associated with COVID-19, such as maybe respiratory infections, pneumonia, and figured out maybe, okay, so because some of them, if it's like some of them clearly weren't linked to COVID. So he did the math and looked it up and figured it out. And what he found was about 50,000 of the people may have had comorbidities linked to COVID. So that's like at the most. That's the most, which is about the typical flu season. That's all it is. And the funny thing is Dr. Fauci compared it to the flu in a opinion piece he wrote for the New England Journal of Medicine in late March. So he knew it back then. So that's how I knew it. I didn't make it up. I knew, because I read. So either way you look at it, what we're dealing with is a flu season here. And it may be a bad flu, but for whatever reason, it ain't bad enough to kill healthy people, young people. So it can't be that bad. So what we have to ask ourselves is, at what point are we going to allow the government to take away all of our rights? Is it whenever there's a flu season? Whenever one person dies, 1,000 people die? What are the requirements? What criteria needs to be met before we just give away our rights? Just let the government have it, give them full control, lock us down, make us wear masks. None of this has anything to do with science. There's no proof that masks works. Even the CDC admitted that a long time ago. I mean, World Health Organization said that asymptomatic spread is very rare. Fauci is on video saying that asymptomatic people have never been the driver of a pandemic. So why the lockdowns? Why the masks? We never had to do it before. Why now? It's because it's not about the virus. It never was about the virus. It's about this great reset. the people at the World Economic Forum got together with Bill Gates and other people. They held Event 201 shortly before this pandemic started. And they simulated the exact thing. This is all in my documentary, which, by the way, it's Pan Deception, which is, and then the subtitle is From COVID-19 to the New World Order. And, it's all in there. This has been planned out. Has nothing to do with the virus. It's the Hegelian dialect. Problem, reaction, solution. And it's all about the solution. So if you want to know what's going on, all you have to do is look at what they're proposing. And it's crazy science fiction stuff. These technocrats have envisioned this for a long time. It was written about in A Brave New World in the 30s. So we're looking at, 100 years ago, almost. I don't know when the ideas came about, so, it's 90 to 100 years old just from that book. And we're just now getting the technology to make that world happen. And the technology could be great. It could free us, or it could enslave us. And it all depends on what's in here, in the masses. But it starts with you. It starts with you. I mean, you've made it this long. If you watched this long, that's awesome. You're going to be the one to make change, not the average person, not the person you sat next to in 5th grade in school. Probably not. It's you. Otherwise you wouldn't have made it on my channel, and if you did, you wouldn't have watched until the end. So unless we get enough people like ourselves together talking about this, forming micro communities, something, unless we can get the masses seeing the light, we're going to be forced to live in this futuristic dystopian nightmare that has been in the works for a long time. And that's what this is all about. I'll do videos in the future. I've kind of touched on it a little bit here and there, but and I'm still trying to figure all the details out. No one probably knows exactly how it's all going to work, but that's clearly their plan. And if you're interested in that, check out my future technology video that I recently put out. There's a lot of information out there, and we're every day we're moving forward on this journey, watching everything unfold together. So, I do think that there is a wonderful opportunity to profit from it. But first you have to make sure you have your security. So, hopefully being self-reliant, or at least as much as you can, so you don't have to depend on the government or the system for anything. That includes power, water, electricity, food. So maybe store some food. Maybe, try to go solar. Maybe, we've just got to get our ducks in a row. But once all that is done, if you have money left over, I've got a video about how to get started into investing in the mining stocks. I think the mining sector, mining stocks, precious metals like gold and silver, I think that's the next boom. This is going to be a wealth transfer. So it's going to have a lot to do with crypto and the monetary metals like gold and silver. I think it's going to be a wealth transfer into these assets. The gold and silver thing has happened over and over and over throughout history. The crypto thing is brand new, so no one knows what's crypto, no one knows for sure, but it definitely looks like that is a part of this whole grand scheme of things, this future world, the new world order that they have planned. So, it could be XRP, Bitcoin and Litecoin with a Lightning Network. They're working on it though. A complete reset. They're calling it the Great Reset. I don't think it's gonna be so great. Not as great as the Great Depression. Also caused by these same types of families and people using the same kind of tricks. But anyway, that's another story for another day. If you want me to cover the Great Depression, let me know in the comments below. It's interesting. It's interesting. But anyway, make sure to hit that like button again. Sorry to keep bugging you guys. That sounds so corny. But, at this point, I don't know when I'm going to do another video. So, if I don't get you guys clicking that like button and subscribing, my work here is done. So it's important. Thanks for watching, and thanks for supporting. Have a great day.